Did you know that one vaccine could prevent most cases of cervical cancer, one of the world's deadliest diseases for women? Yet, millions of girls and women around the world still don't have access to it. Today, we're talking about the HPV vaccine, the science, the progress, and why it's once again making headlines in 2025. The HPV vaccine, short for human papillomavirus vaccine, protects against infections that cause cervical cancer and other related cancers in both men and women. This year, the World Health Organization reported that only 31% of eligible girls worldwide have received at least one dose of the HPV vaccine, far below the global target of 90% by 2030. Despite that, there's good news. New data shows that in countries where vaccination coverage is high, HPV infections have dropped dramatically in some places by as much as 70%, proving that the vaccine not only protects individuals but also helps create herd immunity. A major study published earlier this year made a game-changing discovery. A single dose of the HPV vaccine may offer the same protection as 2 or 3 doses. This finding could revolutionize how countries run vaccination programs, cutting costs, simplifying logistics, and reaching more children, especially in developing countries. Experts say this breakthrough could help accelerate the fight to eliminate cervical cancer as a public health problem. WHO has already updated its recommendations to allow for a one-dose schedule in many cases. In 2025, several regions have taken bold steps forward. In the Pacific, the Solomon Islands rolled out its HPV vaccination campaign for girls aged 9 to 14, a major milestone in local health. Across the Americas, countries are now gaining access to the 9-valent HPV vaccine through the Pan American Health Organization's Revolving Fund. And in South Asia, countries like Pakistan have begun nationwide vaccination drives, targeting millions of girls, even amid online backlash. Meanwhile, new studies and advocacy campaigns continue to raise awareness, reminding parents that the HPV vaccine is a proven cancer prevention tool. But despite the progress, challenges remain. Many developing countries still face low coverage rates, partly due to vaccine cost, supply issues, or lack of awareness. In some areas, vaccine hesitancy and misinformation also remain serious barriers. Additionally, lawsuits and misinformation online continue to raise doubts about vaccine safety. Even though global health authorities reaffirm its strong safety record after more than 15 years of use, experts stress that vaccination combined with regular cervical screening can save hundreds of thousands of lives each year. If you're a parent or a student between 9 and 14 years old, check whether the HPV vaccine is available in your area. Many health centers and schools now offer it for free or at a reduced cost. The vaccine isn't just for girls. It also protects boys from HPV-related cancers and helps reduce overall virus spread. Talk to your doctor, local health worker, or community clinic. A single shot today can mean a lifetime of protection, as the world races toward the 2030 goal of eliminating cervical cancer. The HPV vaccine remains one of the most powerful tools in modern medicine. Science has done its part. Now it's up to governments, communities, and families to take action. So, if there's one message to remember, protect yourself, protect your future. Get vaccinated.